Welcome to the Deep Dive. Today, we're tackling something pretty common. Actually affects about 1 in 11 Americans, kidney stones. And the pain. Well, people famously say it's worse than childbirth. When it hits, you really need to know what's going on.
Exactly. So our mission today is, well, pretty straightforward. Quickly break down how you recognize a kidney stone attack. And crucially, how to tell the difference between something you might manage at home versus a serious, potentially life-threatening emergency needing the ER. Plus, some key prevention tips.
Okay, let's get into it. We hear kidney stone, we think pain. Well, what are they, really, chemically speaking?
So they're basically hard little deposits. Think minerals and salts forming tiny crystals. This happens when your urine gets too concentrated. Now, they don't hurt while they're just sitting in the kidney.
Right.
The agony starts when they move out and try to pass through the ureters. Those are really narrow tubes, and most of them, maybe 75%, are what we call calcium oxalate stones. That's the most common type.
Got it. So the pain is infamous. But how do you know it's that pain and not, say, a really bad backache or a cold muscle? What's the signature feel?
Yeah, good question. The classic kidney stone pain is, well, sharp. It's cramping, and it hits suddenly, often intense enough to wake you up at night. It usually starts in your side or back, kind of below the ribs, then travels down towards the lower belly and groin area.
Okay.
And here's the real key difference. Unlike muscle pain, this pain is relentless. It doesn't change or get better if you shift position, lie down, or stand up. You just can't get comfortable.
Wow. Okay, relentless pain. That sounds awful. So let's pivot immediately. When does that awful pain cross the line into a genuine life-threatening emergency?
Right. This is critical. If you have that kind of pain, you need to check for red flags immediately, because this is where things can get dangerous fast. We're talking about infection risk, potentially leading to sepsis.
Sepsis, okay.
Yeah.
What's the absolute biggest warning sign we need to look for?
Emergency signal number 1, and the most dangerous: fever. Specifically, a fever over a 101.5 Fahrenheit combined with those kidney stone symptoms, that strongly suggests the stone is blocking things up and there's an infection brewing behind it. That can lead to urosepsis, basically blood poisoning starting from the urinary tract.
Because there's sepsis.
Doctors have a term for it: obstructive pyelonephritis. It needs immediate IV antibiotics and often surgical drainage to stop it from becoming septic shock. It's very serious.
Yep. Okay, fever is number 1. What else puts someone in the danger zone? What's maybe the second signal people might ignore?
Signal 2 would be persistent nausea and vomiting so bad that you just can't keep any fluids down. You don't hydrate, the kidney can get injured pretty quickly. And signal 3, you completely stop being able to urinate. That's just a total blockage. Also, keep in mind, stones bigger than about 5 millimeters, they only have maybe a 50-50 chance of passing on their own. So ignoring severe symptoms when you have a larger stone is just really risky.
Right. So let's quickly touch on home management, but only for uncomplicated cases, meaning you have the pain, but 0 red flags, right?
Correct. No fever, no persistent vomiting, you can still urinate.
Okay. In that case, hydration is king. Aim for about 3 liters of fluid a day. You want your urine to be clear or pale yellow. Some people say lemon juice helps.
Yeah, the citrate in lemon juice might help prevent some types of stones, particularly calcium ones, from getting bigger. And of course, over-the-counter pain relief like ibuprofen or acetaminophen can help manage the discomfort. And this is crucial, never, ever just wait it out if you have any of those red flags we mentioned.
Absolutely. So prevention is obviously better than going through that. What's the cornerstone there?
It sounds simple, but it's huge. Hydration. Consistently producing about 2 to 2.5 liters of urine per day cuts your risk of forming another stone by roughly 50%. 50.
Wow, that's a massive impact just from drinking more water.
It really is.
Okay, let's talk diet, because this is where things get interesting, especially with calcium. There's a big myth here, isn't there?
Oh, definitely. People think calcium stones cut calcium.
Yeah.
Makes sense, right? But it's actually the opposite for the most common type.
So what should you do?
You absolutely want to limit your sodium, keep it under 2,300 milligrams a day, and limit animal protein intake too. But, and here's the key, do not avoid calcium-rich foods. Getting enough dietary calcium actually helps bind oxalate in your intestines, preventing it from being absorbed and ending up in your urine, where it can form those calcium oxalate stones.
Fascinating. So adequate calcium is actually protective.
Exactly. And related to that, we see uric acid stones, maybe 10-15% of cases, often linked to high protein diets, especially meat, combined with not drinking enough water. Different cause, same hydration solution helps.
Okay, so wrapping this up, what's the main takeaway for you, the listener, is this. Many kidney stones, while incredibly painful, can be managed at home if there are no red flags. But fever, nonstop vomiting, or being unable to pee those demand immediate medical help. Don't gamble with sepsis.
Right. And maybe a final thought to leave you with. If you have had a kidney stone, the best prevention isn't generic advice. It's working with your doctor after the event. There are different types, like we said, calcium oxalate, uric acid, struvite, cysteine. Analyzing your specific stone is the only way to tailor your diet and maybe even medication to really prevent future ones. That's how you break the cycle.